All right, good morning, everybody. How are all of you today? Good, good. Cold and rainy. I'm so glad we saw everybody. Someone was telling us some people might kind of trickle in if they're coming in through the rain. I'm Dr. Parsons. I'm a faculty member at University of Incarnate Word at the School of Pharmacy, and I have a couple of students with me now, Valeria Faz, who is a fourth-year student, and also Chiara Calantar, also a fourth-year student. They're going to be graduating soon in May, and they're very happy to come and discuss some heart health essentials with you and focusing on high blood pressure, hypertension, and then hyperlipidemia or cholesterol. So you guys can come on up. Valerie is going to get us started, okay?
Good morning, everyone. I'm going to get set up real quick and then I'll get started. Ooh. Okay, so as Dr. Parsons mentioned, I'm a fourth-year student. My name is Valeria, but you guys can call me Val, and I'll be presenting on hypertension. So we'll go through my portion first, and then I'll pass you on to my partner, Chiara. So before I get started, like I said, I'm going through hypertension. I'm sure a lot of us might be familiar with high blood pressure as well as the medications that go with it, or we might even just know somebody that's on those medications. So if you're familiar with any of that, it's definitely a good presentation to tune in on. So my first note here is on what it is. So blood pressure itself is just the measurement of the blood pumping through your body, and it's measured in two parts. It's got two numbers, the top number being the systolic number and the bottom number being the diastolic. Your top number is going to be more representative of the pressure that is going through when your heart pumps, and the bottom number is going to be more representative of when your heart relaxes, which is why it's a little lower. So usually you'll notice the two numbers, I just explained the two, and the makeup of the two make up your blood pressure. When it's elevated, it's called hypertension. I'm sure we're familiar. And over time, it can cause some damage, and we're going to go into the details of that. Okay, so why does it matter? A lot of the times we can't necessarily feel when our blood pressure is getting higher. It's just something that kind of happens. So that's why it's important to keep track of it, kind of keep your eye on it, as well as understand what it is that happens when it is high over a long period of time. So it affects a variety of areas, and I'll go through that in the next couple of slides. But this first one just kind of shows, this first one shows a couple of the areas it mainly targets when it does get elevated. So it'll focus on your heart, your kidneys, brain, eyes, and blood vessels. Of those, some of the ones we might not be as familiar with are going to be maybe peripheral artery disease, which that happens when the vessels in your legs get a little more narrow. Over time, the pressure starts to increase in those areas, and it kind of pumps back upwards, and it increases your blood pressure, which puts more strain on your heart, leading to all of those numbers just going up. And then an aneurysm is going to be an area in an artery that is weakened, and it kind of forms like a weakened balloon, if you will. And over time, your blood pressure, if it starts to increase, can kind of weaken it even further. And then if, God forbid, but if it gets more weak, it could rupture, which is the worst case scenario. But these are all possibilities, and the reason why it's important to keep such a close watch on the blood pressure. So a good thing about this, though, is that blood pressure is very manageable, which is why we're talking about it today. If it's kept controlled, you're probably not very likely to get any of these things happening to you. But it's still good to keep them in mind, because sometimes if there's no understanding behind why we're doing the things we're doing for healthcare, and it just kind of feels like a lot of numbers written down, and we're not really, why am I bringing these to my doctor? Why am I having to check it so often? The reason is this. It can lead to these things. So because we want to keep you all as healthy as possible, we want to try to prevent that. So this next slide is the areas that I just highlighted, as well as what else contributes to it. So there are things we can't control, like our genetics and aging. So that's completely out of our hands. That's just going to happen with time. But other things we can control, lifestyle changes, changes in our diet, as well as medication adherence, which we'll go through, are all things that will contribute to us preventing these severities. So here, I don't have a pointer, but I'll just lead y'all through the picture. In the bottom left, that's how y'all are oriented. We kind of have a little bit of a face. That face is representative of lifestyle factors, environmental stress, things that are within our control sometimes, maybe not so much the stress part, but the eating, the exercise, the daily habits, that stuff we can control. And the reason why it's important, because I mentioned, is it keeps your blood pressure regulated, but other things like our brain, our heart, and our kidneys, sometimes over time, they'll just get weakened. The blood vessels there will get weakened, and those things are only better controlled with lifestyle changes in the eating area. So that stuff's actually going to have a more of an effect if you change your eating habits. We've seen way more of a benefit to those changes, actually, rather than starting medication. So if your doctor catches it before you get to the medication stage, you have a great chance of being able to keep it at bay if you make changes in your eating habits and lifestyle. So that's why we highlight the organs, because it's important to know where this is headed if it were to go that way. So, knowing your goals. For most people, it's going to be 130/80, but a lot of the times people have goals ranging from 140/80 or 140/90, and that's due to a thing called systolic high blood pressure, and that's just when your top number is high, and that's all set by your doctor. So if your doctor's told you to follow a different blood pressure goal, definitely stick to that. And that's totally normal as well, and that's a good goal to go by. A lot of other resources like the American Heart Association and those types of websites, they'll say 130/80, but 140/80 or 140/90 is still a good number. How to manage it, it's just going to go ahead and stay really adherent to your medication. Don't ever stop taking it, and we'll go over more of those details throughout the slides, as well as continuing the lifestyle choices that you've tried to change and successfully changed. Those things are really hard to do, but if you can do them, hey, kudos to you, and definitely keep that up, because it's going to make more of a difference in the long term. Another thing I wanted to show y'all is this really cool blood pressure monitor. Y'all might already have it, but I didn't know that this one actually takes your blood pressure for you and keeps track of it for you. So if you're not somebody that wants to write it down consistently, or you might forget, this one's a really cool device to get your hands on if that's possible. So one important thing, like I mentioned, never stop taking your medicine unless you're talking to your doctor about it, even if your blood pressure looks normal. It's important to keep it up. So, how to go ahead and take your blood pressure. This picture here is from the American Heart Association. It's a really great image giving you great tips on how to do it properly. I'm sure most of us already know how to do it, but in case we're missing any of the steps, I'll just go ahead and highlight all of them. So our first area we'll look at right here is what to do before you're going to take your measurements. You want to make sure you've been resting for 30 minutes, no exercise, because that can alter the results. You want to make sure that you are not smoking, not taking any kind of caffeine, no kind of alcohol or anything like that. I mean, usually we're taking it in the morning, but you never know, so it's good to mention. So definitely look out for that, because you want as accurate as measurements as possible. So that's the first step, is make sure of all those things. The next area we'll look at is go ahead and rest for at least 5 minutes once you've actually sat down and you're getting ready to take it. So I would probably sit down for breakfast with my machine next to me. That's what my dad does. Sometimes I'll take it for him when we're sitting down before we have our coffee. I'll be honest, we have forgotten sometimes, and we have our coffee before, but we do note it. So if that happens, just take note of it. If your measurements are a little off, that could be why. But definitely rest for 5 minutes. This one's kind of hard for me. Don't talk. That one, I don't know about that one. I have a hard time in the clinic even with the patients. I'll be talking their ear off and then I go, oh my gosh, I have to stop. But that's a good one to remember because it does really change the numbers, believe it or not. So don't talk, as hard as it may be. Rest your arm as level as you can with your heart. I try to just rest it on the table. That's what my dad does. And then keep your legs level with the ground and your feet flat. I have a bad habit personally. I mean, I don't get my blood pressure taken often, but when I go to the doctor, I tend to cross my feet. And it's a real bad habit, and it does alter the number. So definitely take note of that. I feel like these are the things that most often we neglect because it's really easy to forget. So definitely taking note of that's important. So another thing that they like to point out is to take at least 2 measurements. They try to have you wait a minute in between measurements. That's the best way to go about it. And it's more accurate. It gives you peace of mind. If the first number comes up a little high, you take it again. It's more normal. That gives us, kind of a deep breath, fresh air. We're okay. We can move forward with our day. If you notice that one arm is higher than the other, that's the arm you're going to want to be taking your blood pressures on. So if you've never taken your blood pressure and you're looking to start now, test both your arms. Whichever one has a higher blood pressure, that's the one you're going to consistently check on. Okay, so that's another thing that, actually my dad didn't know. So I had to recently tell him, and now he's doing that. So he's taking it on the correct arm now. If you've been doing it on a specific arm and you're not sure which one's the correct arm, now's a good time to check. A question that a lot of people have, I think I might touch on this later, but I'm thinking of it now, so I'll just let y'all know. Arm cuffs or wrist cuffs? Arm cuffs are always going to be better than wrist cuffs. They're a little more accurate. It's easier to target the artery compared to your wrist. Now, if you have a wrist cuff and you're not willing to change it, that's fine. I would take it to my doctor and have them compare it against the machine they use there. See how accurate that is. Now, if you're already taking home blood pressure and you have measurements written down and they're all relatively accurate to what you're seeing at home and you do it on a wrist machine, you're probably good to keep going with that one. But if you haven't purchased one, I would go ahead and get an arm one because that's probably going to be better, more accurate for you down the line. All right, so many of you are familiar with medications like I mentioned when I started. So now we'll go over some pretty popular ones and some side effects that go along with those. So some classes of medication here. I've got water pills, ACE inhibitors, calcium channel blockers, and beta blockers. Examples of those medications are listed below. You might know them by their brand names as well, but these are all pretty much the general classes of medications that everyone for the most part tends to take unless there's a specific case requiring otherwise. Most of the thing is with these blood pressure medications, they're all going to cause dizziness for the most part. So that's not an uncommon side effect. It's all possible with any blood pressure medication. Specific common side effects, with the water pills, you can have increased urination. ACE inhibitors, you might have a little bit of a cough sometimes. It's common. Channel blockers can cause some swollen ankles, edema in the lower half, or beta blockers can sometimes cause a bit of fatigue. Now, if you're feeling any of these, again, it's important to not stop the medication, although it can be scary to feel side effects of it, but definitely call your doctor as soon as possible. I have another slide later talking about when it's better to call the doctor versus go to the hospital, and we'll go through that later on. But another thing to note is if we're taking our blood pressure at home, definitely know when it's too low. Because hypertension is important, having really high blood pressure is good to know, but low blood pressure is important also. And just because you have hypertension doesn't mean you can't have low blood pressure. It's possible. So low blood pressure is going to happen when you have a reading less than 90/60. So it's definitely important to notate that if it's happening consistently, especially, go ahead and call your doctor then. But every once in a while, if it's happening, I would mention it next time I visit my doctor because it is important and you might need to have your medications adjusted. So Now, when to follow up with the doctor and what's going to happen when I do. When you're following up with your doctor, we might already be familiar with this. I've gotten lab work done, so I'm sure many of us here have as well. What they'll do is they'll get your lab work done, usually through blood. And so what they're checking is your kidney function, your electrolytes, and they're also checking your blood pressure, which you should be checking at home as well. The reason why they're checking these things is because through these checks, we can go ahead and evaluate how well this medication is working for you, if at all, because sometimes it's a trial and error basis, right? You have to try some stuff, figure out what's good for you, and then see if it works. It's not always going to be the same just because it worked for someone else. Doesn't mean it's going to work for you. So we have to try on a patient-by-patient basis. And how we evaluate that is through these lab works. So what they're checking for is kidney function, your electrolytes, so it'll be your potassium or your sodium, and then your blood pressure, and it definitely helps when you guys are bringing in the readings as well. That's going to be immensely grateful to any provider, because if the electrolytes and the kidney function is all they have to go off of, I mean, that's good. But we want to know how you're feeling every day. That's the important thing. That's what we want you to feel good with, so that way you can continue your daily activities and it's not affecting you in any way. We want you to live as much of a normal life as possible despite having hypertension, if that is something that you have. So it's important to bring in these readings, and you'll see I have it written down at the bottom with a star because it's real important. So I mentioned it so many times, but it just really helps so much to better y'all's situation if you do struggle with hypertension or any of these medications. So here's that slide I was referencing earlier. When to call your doctor. I kind of tried to do a little bit of a stoplight coloration, so it looks like green, yellow, and red. So you know when you're good to go. Green is good to go. Yellow, we're kind of stopping, taking a break, and red, we're full stop. We're calling the doctor. We're going to the hospital. So when you're green, you're in a good place to keep staying at home. Monitor yourself. This is when your blood pressure readings are staying consistent. They look the same as they usually do. You feel well, and you're taking your medications as prescribed. We're in the green here, we're good. Now we're moving on to the yellow category. This is where we might consider calling our doctor, maybe seeing if they can check in on us sooner rather than later. If you have somebody at your disposal to come check in on you in the next couple of days, even better, right? That's the area we're in right now. So we'll be in this area when the blood pressure is consistently above goal. So when we're checking ourselves, writing it down, we notice, oh, we're kind of a bump up in what I'm usually reading. And we're having the side effects that I mentioned earlier, so any dizziness, any kind of swelling. A good way to check, which is how you'll notice they'll check you at the doctor's office for swelling in your legs. My dad always finds kind of his bone right here where your shin's at, and then right next to that you'll take your thumb and kind of press inwards for about 5 seconds, and if you take your finger off and it stays indented, you've got leg swelling, and it's good to notate that. So it's a good way to check yourself. You don't have to have anyone around you. Now, some people might have swelling every day. If that's the case for you, take this with a grain of salt. Salt's a little funny because hypertension, but take it with a grain of salt. But definitely check yourself. If you're someone, that you don't have swelling usually, and you're noticing a little bit of swelling, or you feel like it's difficult to move around, your legs feel a little heavier than usual, I would just take note of that. Okay, another symptom is you're feeling dizzy, lightheaded. So we'll feel that a lot of the times. We stand up too fast or things like that. Now, again, you know yourself best. So if this is your baseline, or if this is what you're usually struggling with, then again, with a grain of salt, but definitely take note of it. And another notation is to call your provider is when you're having significant changes in your home readings. I mentioned this earlier with saying when it's consistently above, you'll want to contact them. But if it's significantly different as well, I mean, even if it's low, right, you're going to want to call them, because it might be that your medication is too strong for you. And you might have done lifestyle changes that now is leading you to a lower dose, which is also a good thing. But if you're taking too high of a dose, we've got to call somebody. Okay, so our red category, when to get to the hospital. This is going to be when we have too high of a blood pressure. When is that? That's when we have anything at or above 180 over 120. That's too high. We're going to want to go to the hospital for that. Don't call your doctor. Call the hospital, because if you drive or anything like that, we don't want anything to happen to y'all. It's too much of a risk, anyone really. So I would go ahead and call 911 at this stage. So it's when you're having this blood pressure reading and symptoms of chest pain, shortness of breath, vision changes, confusion, or difficulty speaking. Any of those things are going to warrant a call to 911. So those are pretty severe symptoms, and they're kind of hard to keep in mind when there's not something easier to help you remember. So I have an acronym for stroke, which is a little bit different, but a lot of these symptoms do lead to that. So it's important to notate that, and we'll go ahead and move to that acronym. So high blood pressure can lead to a stroke, and that's one of the more severe complications, not side effects, excuse me. But it's important to know when you're having one and how you can tell. The acronym BFAST is one that's very widely spread. I'm sure we've all heard of it, but if we haven't, well, here it is. It's really important to get very familiar with it. I personally had somebody in my life that had a stroke, and I actually was present when it happened. And when I tell you that those symptoms are quick, they are quick. So it's not something that's, you're feeling a little bit off balance, and it'll be quick and it'll be very severe. So you'll be able to tell. And it's important when you have somebody around you, if they can tell anything like that, to listen to them. And definitely don't put it off. So the B is going to be for balance, E is for eyes, F for face, A for arms, and S for speech. T is just time, meaning time is of the utmost importance. You want to try to call 911 as soon as possible when you feel a loss in your balance, any changes in your vision, your face drooping, specifically one side only. That's very evident, and it happens fast. It's like you can't move one side of it. It's very severe. And then your arms, you'll feel weakness, and a lot of the times it's just on one side, the same side that you feel the drooping. So definitely take note of them, and do not ignore if these come across. The speech will slur, and it'll kind of slow a little bit. You might have a difficulty enunciating when this happens, or if this happens. Let's all hope not, but it's, again, important to know how to spot it out. The most important thing is do not drive yourself to the hospital. I already stated that earlier, but again, I'll mention it. I think a lot of us, myself included, will panic and will think, I'm okay, it's not going to happen, it's not going to get worse. But a lot of the times it can, and it's important not to go ahead and do anything drastic. So that's when to call 911 as well, is when you're feeling any of these BFAST symptoms. When to call 911, and it's not necessarily attached to the high blood pressure, is even if you're not having the 180/120, but you've got the severe chest pain or shortness of breath, go ahead and call. Loss of consciousness is obviously going to warrant a call to 911, definitely. But I would say if you're feeling the chest pain or shortness of breath, be honest with yourself and just go ahead and make that call. All right, like I mentioned earlier, lifestyle changes greatly contribute to decreasing the severity of the complications as well as the likelihood of any of those happening to you. And a lot of the recommendations in terms of diet line up with this thing called the DASH diet, which is what's recommended by the American Heart Association. And what they recommend is just to eat a lot of really whole fruits, vegetables, and as well as whole grains and lean proteins. So low fat, high protein, a lot of clean fruits. So my dad personally loves the canned peaches. That's his favorite type of fruit, but I've tried to explain to him that's not, we can't have that as fruit because that's got a lot of sugar in it and it's not going to do you any good. So when we say whole fruits, that's kind of hard to envision. You're thinking, well, what do you mean if I eat a whole, that's what he said to me, if I eat a whole can of those, is that a whole fruit? I said, no, it's going to be a whole apple or a whole orange, unpeeled, none of that stuff that's in the juicy, the what? Oh, I wish. No, my sister's a lawyer. No, let's not get into that. But yeah, so he tried to get away with that one, but he's doing the fresh fruits now. He has to peel the orange, and he does enjoy it, and he does his peaches as well. But I always tell him, if it's got seeds or a pit, you're in the right direction. That's what we mean by whole fruits, okay? And so his vegetables, he's good on that because my mom makes him. But as long as it's green, I always tell somebody you should have your plate should try to look like a rainbow if possible. But if not, if you see a little bit of green on there, you're probably headed in the right direction too. Protein, I've always heard about the size of the palm of your hand is what they used to suggest. They're always changing how you should or shouldn't eat. But I always stuck to that growing up, and recently my dad has been sticking to that, and he unfortunately has kidney problems, and he's seen a great benefit with that. So he's been seeing really good changes with his lifestyle habits, more than he's ever seen in 30 years that he's had diabetes, hypertension, and kidney problems. And he's had like a lowering in his GFR, an increase in GFR, lowering in A1C. It's all just gotten so much better for him because of these lifestyle changes. And it sounds silly. It really just sounds like, oh my gosh, not to be disrespectful, but I roll. The doctor's telling me to eat healthy again. This is what they tell me every time. But it really does help. I hate to continue to hone in on the same point, but it's just so much more beneficial than the pills, because I know it's so annoying when another pill gets added onto the regimen. You're just like, oh my gosh, I really don't want to be doing this. Well, this is how to combat that. So again, the DASH diet is going to be whole fruits, vegetables, lean proteins. So chicken, fish, that's going to be great lean protein. And then reduce your sodium. If you're counting it or if you're keeping track of it, you're going to want to aim for about less than 1,500 to 2,300 milligrams. 1,500 is a little hard, so if you're staying in that range, you're probably in a good spot. And it's important to note that high sodium doesn't just come from the salt shaker. It's going to come from processed foods, and it's going to come from restaurant foods, and the McDonald's and all that. Unfortunately, the yummy stuff, that stuff's going to have all the high sodium. So it's hard, but it is what has the high sodium. It's the processed stuff. The quick stuff, we don't want any of the quick stuff. Moving on, the maintaining a healthy weight's real important too. Your doctor will keep track of that, and they'll give you the goals and as far as BMI, where to stay, how you're doing, how they want you to progress. But if you know you're overweight and it's something that you're willing to work on, you'll see immense changes in your regimens for any kind of illness that you might be dealing with, whether it's hypertension or diabetes. And then, of course, avoiding any type of alcohol or tobacco will definitely help with that. So in terms of lifestyle changes, a question that often comes with it is, what about natural supplements? Can I do anything in that regard? Can I get anything over the counter that's going to help me? And there's a couple of them that we do talk about and we see often in these patient populations, and they're listed here. It's going to be beetroot, the hibiscus tea, garlic, and then omega-3 fatty acids. So these can be taken with caution. If you're already taking them and your doctor's aware, that's totally fine. If they're okay with it, definitely just go ahead and follow the instructions on the bottle. Don't take more than what's recommended. The reason we always recommend you stay more on your prescription medications rather than natural supplements, though, is because unfortunately they're not as regulated as prescription medications when they're being made. It's different organizations that are making them, different people that oversee them, versus prescription medications, all FDA approved and verified that they're safe for you to take, for the indication that you're taking them as well. That's the reason why a lot of these times, these supplements, they might be safe, but then you look into it and it's, for specific recommendations other than blood pressure or things like that. And so that's why we recommend if you take them with caution, definitely. Now, in terms of the omega-3 fatty acids, I know they were real popular a couple years ago and even recommended over the counter by doctors. Recently, they've been trying to get away from that because of the same thing I just mentioned. They're not as regulated. They can't assure that they're safe for you. So we try not to push anything on y'all as well as your pockets. That's not going to be an assured, safe thing for you to take, as well as you see actual benefit from it. Now, one thing you can talk to your doctor about if you're really interested in taking a vitamin is a prescription omega-3 fatty acid, which, not to continue to bring him up, but my dad's actually on, and he really likes it. It's Vasepa, the specific one that I'm thinking of, and that one is safe, it's prescription, it's regulated, and it also is proven to actually help decrease your cholesterol levels. So the other over-the-counter medications, there's no actual data to back the fact that it will help, which is why we kind of stray away from those and those supplements as a whole, because there's no data and there's no regulation. But again, if you're already taking them, it's something that's in your habits and your doctor's comfortable with it and you're following the instructions on the bottle, you're fine to continue. Okay, so reliable resources. We have the American Heart Association, which I've quoted quite a bit through this presentation. They're a really great resource. They have a website. They've got exercises that you can do there. They've got different recipes that you can follow. And they also have all the guidelines, which they're a little wordy, but I mean, if you're into that kind of stuff and it's interesting to you, I know a lot of people here are retired healthcare employees, so if that's interesting to you, you're more than welcome to read. It's essentially explains why we're taking everything the way we're taking, why the doctor recommends what they recommend, and why the medication we're using now is what we're using. And it's always backed by a study, and usually you can go read that too if you're interested. There's this really interesting app that I actually just found out about. If you're into apps, which I know some people might be or some people might not be, but this one helps you remember when to take your medications and when you need refills. So you'll put in your information and you'll put in your prescription meds, how often you're taking them, and it sets alarms for you, and then it lets you know, like, hey, take your medication, you know, it's that time. So I thought that was pretty cool. And if you're using alarms or things like that and you find them to be bothersome, or you forget to turn them on, or things such as that nature, then this might be a good app to look into. It's completely free and no cost.
What's the name of the app?
It's called Medisafe. It's going to be spelled MEDISEFE, excuse me. And it's a medication reminder and pill organizer. So it'll send you reminders for when to take it as well as when to refill it. And I believe it's a couple of days prior to you finishing your medication that it reminds you, which is great because, well, I don't know where you guys might have in-house pharmacy, but if you don't, if you get it through Walgreens, CVS, or things like that, sometimes it might not be ready same day, or they might be out of it and they might have to outsource to a different pharmacy or things like that. So this app helps you remind the pharmacy to fill your medication before you're done with it too. So there's no lagging in your medication, which is important for these types of meds especially. Right here I've got the DASH eating plan, which is what I was talking about earlier. It's got pictures of all of the stuff that they recommend you eat versus the things they recommend you limit. And it's, like I said, unfortunately, a lot of the fun stuff that they limit. But I personally think that the healthy stuff can be really fun too if you get creative with your recipes. My mom has been venturing. We personally love tortillas in my house, and she recently started making chia tortillas. I don't know if y'all are familiar with the chia seeds that get like kind of gummy when you put them in water, and they're really good for your digestive system. I don't know how she does it, honestly, but it's got chia in it, and my dad's a tortilla fiend, and he had to stop eating them, and that really helped him. So, I mean, it's extra time, you know. I don't know how long it took her, but if you've got the time and you're willing to kind of experiment in the kitchen and that's something that's interesting to you, it can definitely get fun for sure. Even once you've had to let go of the sugary beverages or the dairy things. But that's another resource that we definitely recommend, the DASH eating diet plan. And then finally, your pharmacist. They're a great resource, and they're usually very available, much more available than your primary care physician or even your specialists. A lot of people forget that we're here, but we're here for y'all. We can answer any questions at the pharmacy about anything, even if it's over the counter. You can go right up to our desk, ask us anything. A lot of the times we're available. It gets busy sometimes, but any pharmacist should be able to step away for a second and answer your questions. It could be even, as simple as a Band-Aid question, if you're allergic to any adhesives or things like that, they're there for you. So they're a really great resource. They're free. They're available very readily for the most part, and they'll help you with anything in terms of any side effects as far as that, and as simple as something from, which Band-Aid is best for me, or when can I call my doctor for refills, or which medication do you recommend? They're there for you too. So we can help you all with anything like that. And if you have any questions about any of my portion of my presentation, I'll be happy to take those at the end. I'll go ahead and pass on over to my partner now. But I wanted to thank y'all for your time. I also thank y'all for your service. I really appreciate everything y'all have done for the country. It's really admirable, and honestly makes my skin crawl, or not crawl, but like my skin, get goosebumps. I'm bad at the sayings. I speak 2 languages, and sometimes I'm like, where did the chicken cross the road, or what is it that it says? So sorry about that, but I get goosebumps just thinking about how much y'all must have sacrificed, and really it's just so admirable. So I really appreciate it. Your time, as well as everything that you gave to our country, so thank y'all.
Thank you, Val, so much for that great presentation. Hi, everybody. How's everybody doing? Good, awesome. Thank you so much for being here today. Yeah, I know it's rainy weather, definitely like not the safest to be driving, so we really appreciate y'all being here today. My name is Kiara. I'm a pharmacy student. I'm in my 4th year, so we're almost done. We'll be graduating in May, which is insane to say. It's gone by really, really fast. But we're really grateful for being here today. Thank you all so much for having us. And I would just like to echo what Val was talking about. Thank you so much for your service, and we really appreciate y'all. Thank you so much. Okay, so for my portion of the presentation, I would like to talk to y'all a little bit about cholesterol, which I'm sure that we have all heard about at one point at least in our lives. Okay, so here we have understanding hyperlipidemia. We're going to be talking a little bit about what it is. We're going to be defining it. We're going to learn why treatment matters and why it's important. We're going to be reviewing some of the most common medications that are prescribed, their side effects, discussing a little bit about lifestyle changes, reviewing common questions, common misconceptions about certain medications, some of which are called statins. I will go a little bit into that in a little bit. And then we're going to also be reviewing some natural supplements. Okay, so what is hyperlipidemia? Essentially, this is just a fancy word for high cholesterol. And whenever you get your cholesterol taken at the doctor's or you go to the lab and they get your blood drawn, they are going to be looking at 4 main lipids. Essentially, we have the total cholesterol, which encompasses your LDL, that is your bad cholesterol. And generally, we want this number to be less than 100. And it's called the bad cholesterol because it's the cholesterol that is going to your tissues. Therefore, it will kind of stick there and it can accumulate, and with time, that can lead to really bad complications. Your doctor might have you, might want your LDL levels to be a little bit lower than 100, but that just depends on other conditions and comorbidities that you might have. And then we have the HDL. This is the good cholesterol. We want this to be above 40 for men. I am so sorry. Okay. We generally want the HDL to be above 40 for men and above 50 for women. And this is known as the good cholesterol because it takes your cholesterol back to your liver. Therefore, you can get rid of it. And then we have the triglycerides, and essentially this is the type of fat that your body uses for energy. So all of that other cholesterol, it gets put back into your cells, and it kind of just sits there waiting for you to use it for energy. And we generally want this to be less than 150. Okay, so let's talk a little bit about how high cholesterol happens, what happens with your arteries. That way you can visualize it a little bit, because I feel like explaining it is different. Oh, you have high cholesterol. What does that mean? So here I have a couple of pictures on the right side. At the top, we have what a normal artery should look like. Think of a straw. Just think of your arteries as straws, and it's clear. There's a clear pathway for your blood and for your oxygen to pass through. But as your LDL levels rise and your cholesterol goes a little bit out of control, it can start accumulating. And we have something called plaque building up, and that straw gets a little thinner. Therefore, your oxygen and your blood, it's not able to pass through as easily as it used to. And then in the bottom part of the picture, we have what's called plaque rupture. So let's say this is worst case scenario, where if you have so much of that LDL accumulated in your arteries or in the straw, then it can lead to it rupturing because there's so much pressure going through that straw. Therefore, it can rupture and it can travel to different parts of your body, which we do not want. It can lead going to your heart or your brain, and unfortunately, it can end up causing a stroke or a heart attack, which, worst case scenario, we do not want that happening. But over the years, you might see the arteries are going to narrow and the blood flow might decrease a little bit. So this is essentially what we want to avoid happening. Okay, so leading into why treatment is important. So treatment lowers your cardiovascular risk before symptoms develop. And I'm sure y'all know you don't feel high cholesterol, right? You don't feel like my cholesterol is 200, 300. These are not things that you feel, similar to blood pressure. So that is why testing is very important. But essentially, this reduces the risk of a heart attack. It lowers the risk of a stroke. It also helps to protect your organs. For example, your brain, which I actually didn't know. As I was doing my research, I found that whenever you're lowering your cholesterol and you're treating it, it actually helps to preserve your memory, and it prevents you from having memory loss. And this is because we are protecting our arteries and we're protecting our veins from all that cholesterol building up. Therefore, you have good blood flow and good oxygen to your brain. And then it also helps to prevent something called pancreatitis, and this is just inflammation of the pancreas, which can happen whenever you have high levels of triglycerides. And then overall, we just want to make sure that we're improving our long-term health and survival. Okay, this might be a little overwhelming, but I'll walk you all through this. So these are the most common medications that you might see prescribed for cholesterol. I'll start off with the statins. I'm sure you all have probably heard of these medications. Some of the examples are atorvastatin, rosuvastatin, simvastatin, pravastatin. They all end in statin. And these are the most common medications prescribed for lowering cholesterol, and it's because they're so effective. They can help lower cholesterol up to 50%. And some of the common side effects of these medications include diarrhea, some muscle pain, a little bit of malaise, just like feeling tired and weak. And then also they can increase blood sugar. And some serious side effects to watch out for, which they rarely occur, but I just want to make y'all a little bit mindful of these things that could happen, are muscle breakdown. And a way that you can tell if this is occurring is the patient might experience severe muscle pain or maybe some dark urine. And liver injury. These medications, like I said, they're very, very effective, but like all medications, they don't come without their side effects, unfortunately. But like I said before, these are very rare side effects. It's just good to be mindful of them. And a big counseling point with these medications is that we do not want to take them with grapefruit juice, and that's because it increases the risk of developing these side effects. Okay, and then we have the cholesterol absorption inhibitor. It does exactly what the name is called. It prevents cholesterol from being absorbed back into your body, and this is known as ezetimibe or Zetia. Some of the most common side effects of this medication are diarrhea, and maybe some pain in the extremities. And some serious side effects are signs and symptoms of allergic reaction, maybe liver damage, some muscle soreness. But again, these are very rare to happen. And then we have our PCSK9 inhibitors. These medications are injectables. They can be injected as soon as every 2 weeks. And the medication that is most commonly prescribed in this class is called evolocumab, also known as Repatha. And because it is an injection medication, you might notice maybe some injection site reactions, a little bit of redness, some soreness in the area, maybe some flu-like symptoms, not feeling well, a little bit of back pain. And then just watch out for any allergic signs and symptoms. And we have our bile acid sequestrants. These medications start with chol for cholesterol. So one of them is cholesevelam, cholestyramine, cholestipol. And some of the side effects of these medications are maybe mainly GI, so any constipation, maybe some abdominal pain, bloating, some gas. So it's very important with these medications to make sure that we're staying hydrated and that we're eating a lot of fiber in our diet. Okay, and then we have our fibrates. The one medication in this class that is mostly prescribed is called fenofibrate. And with this medication, it's very important that it's not taken in patients that may have liver or any renal or gallbladder disease, and that is because it can worsen it. But some common side effects of this medication include some muscle soreness, abdominal pain, inflammation of the pancreas, some headache, among others. So going down the line, these are medications that are a little less prescribed than the statins, or less commonly prescribed. And lastly, Val already alluded to this last one, the omega-3 fatty acids. So these mainly help to lower our triglyceride levels, and the two medications that are prescribed are Vascepa and Lovasa. And common side effects of these medications are mainly burping, some altered taste. But because these medications are derived from fish oil, it's important that if you have an allergy to fish, you do not take these. And then these are some of the side effects that you definitely want to let your doctor know about. Similar to what Val was talking about, but I will make it a little bit more specific towards cholesterol, is if you're experiencing any muscle pain, any severe muscle pain that doesn't seem to go away, or any muscle weakness, maybe severe fatigue, especially after starting a new medication, or maybe they increase the dose. If you notice that the urine is turning dark colored, maybe tea colored, that might be another sign that your liver might not be functioning properly, or any yellowing of the skin, severe abdominal pain, nausea that doesn't seem to go away, maybe some rash or swelling. So these are just good to point out, let a healthcare worker know about these, okay? And then we have our labs. So the doctor or the provider will want to check up on you, make sure that these medications are working, that that your liver is functioning properly, that everything is going in the right direction. So there are two main tests that are performed, and we have the lipid panel. And this includes the total cholesterol, your good cholesterol, bad cholesterol, and triglycerides. And usually this test will be done before or maybe every year, just to check on the levels. But if you are started on a medication or they're changing the dose, they might do it a little bit sooner than that. So maybe every 4 weeks to 12 weeks. And let's say that you've been on these medications for a long time and everything seems to be under control and they're working for you, they might check it maybe every 6 months, every year, depending. And then they're gonna want to check on your liver function tests and make sure that, again, the medications are working properly, that there's nothing wrong going on. Okay, so a common question is, do I need to fast before my lipids? And the answer is that it depends. It depends on what the provider wants to look at. Most of the time, you do not have to fast for these tests. However, if they do want to look at your triglycerides a little bit closer and monitor them, or if you have diabetes, or if they want to look at any lipid disorders, they might ask you to fast anywhere between 9 to 12 hours before you have these tests done. Okay, so these are pretty similar to, these non-pharmacological treatments are pretty similar to hypertension or diabetes. We definitely want to make sure that there are some good, the diet, we want to make sure that we're limiting red and processed meats. And this is because this can actually increase your cholesterol levels, and specifically your LDL levels, which is your bad cholesterol. And this diet specifically that's recommended is called the Mediterranean diet. And it includes eating fruits and vegetables, whole grains, nuts, fish, fiber. But again, we want to make sure that we're limiting those red meats and those processed meats, as they can increase your cholesterol levels. And not to say that you cannot have them. You can have them like once in a while, right? But for the most part, just trying to keep that out of your diet. Okay, and then for exercise, these are the recommendations, but as long as you're staying active and you're trying to, I don't know, maybe go on a walk after dinner, or do chores around the house and you're trying to stay active, I think that that is the most important thing to do. But per the recommendations, they do say to do at least 150 minutes per week of moderate intensity exercise and try to do resistance training about 2 times per week. And then also avoiding tobacco products, limiting alcohol, making sure that we're reaching and that we're maintaining a healthy weight, and that we're getting adequate sleep, which I know can be a little bit difficult, but actually there have been studies that have shown that getting adequate sleep of about 7 to 9 hours does help reduce your LDL levels and increase your HDL levels. Okay, so now on to some natural supplements that you might hear a little bit about maybe on the news, or I don't know, the newspaper, or people might talk about that might help lower your cholesterol. Here we have fish oil, which is the one that you can is sold over the counter. And this one shows to lower triglyceride levels. However, it may increase LDL levels. And this is probably a reason why it has fallen a little bit out of favor, is because, yes, we're targeting one thing, but then we're increasing the other. So that might not be as effective as a whole. And then we have something called Cholestov, and this medication is actually derived from plant cholesterol. And essentially what it does is you take it twice a day with your largest meal, and it's supposed to reduce how much cholesterol you're absorbing from your meal. And then we have red yeast rice. This supplement is it's identical to one of the statin medications that I mentioned before. It's called lovastatin. Therefore, if you're already on a statin medication, it's very important that we're avoiding taking this one, as it is the same medication essentially. Therefore, side effects are just going to increase, and definitely we do not want that to happen. And then we have garlic and green tea extract. There's a lot of mixed evidence on the efficacy of these medications. Some of the more higher doses have been shown to be a little bit more upsetting to the stomach and causing liver injury. Also, if you're on any diabetic medications such as metformin or insulin, or maybe even some blood thinners, they could interact with those medications as well. And then I also found berberine has some evidence that it might lower your LDL levels, your cholesterol, your triglycerides. However, it is also known to cause some GI side effects and drug interactions with insulin and metformin. So I put here a little line. Bottom line is, similar to what Val was mentioning, is that these medications are not overseen by the FDA, meaning that they could vary from product to product, brand to brand, how much of the active ingredient is in that medication, and there could also be some potential drug side effects. So if you're already taking them and your doctor is aware of it and everything's okay, by all means continue and they're working, that's great. However, just be mindful that they could have a potential side effect if you start taking them and you're already on other medications. Okay, so here I found some of the most common questions when it comes to treating cholesterol. So one of them is that statins cause dementia, and this was a problem a couple of years back. Is what I found is that people were believing that statin medications actually cause dementia, but they looked into it and they did a lot of evidence review, and they found that actually it reduces the risk, or it doesn't. There's no correlation between statins causing memory loss. So I would say definitely the benefits outweigh the risk. However, if this is a concern for you, if you want to look at more information, I will talk a little bit about what are some good resources that you might look into just to be informed a little bit more. And then I have here that natural supplements are always safer than prescription medications. And like I mentioned, this is not always the case. There are some over-the-counter medications that could be effective. They could help your cholesterol levels. However, if you're already taking a medication that is FDA approved and has gone through a lot of testing and has been studied very, very well, that might be a safer option for you. And then high cholesterol usually has no symptoms. Like I said, this is a fact because I do not know what my cholesterol levels are right now, actually. And I'm sure y'all probably don't unless y'all got your labs done pretty recently. So it's not something that we feel. It's just something that we have to check up on once in a while just to see how our levels are. Okay, and these are some of the reliable educational resources that I came across as I was preparing for this presentation. The American Heart Association is amazing. They update it pretty frequently. We have the CDC, Mayo Clinic also. They talk a little bit about the medications and the supplements, and they go a little bit over cholesterol as a whole. And then we have the Academy of Nutrition and Dietetics. Thank y'all so much. Thank you so much. What questions do y'all have for us? And y'all can ask any questions, whether it was regarding hypertension or dyslipidemia. Yes, sir.
Two different diets, the Mediterranean diet and the DASH diet. Are they the same? So I have to eat twice, one under one and one under the other?
Well, that's a really good question, sir. Thank you so much. Yes, so Mediterranean diet versus the DASH diet, right? Two different diets. but if you look at them, they're pretty similar. The Mediterranean diet mainly focuses on cutting back on those red meats and those processed meats, as they can increase your cholesterol levels. But with the DASH diet, we're trying to increase our protein, lean protein, and reduce sodium. Yes, but it's about incorporating more fruits and more vegetables into your diet, whole grain, and things like that. Do you have anything to add to that?
It's just really dependent on what it is specifically that you're trying to target. If your problem is more the cholesterol, I would follow the Mediterranean diet. But if you're hypertensive more often than not, then probably the DASH diet is your best bet. The main message more so, though, I would say for both of the diets is definitely whole fruits and vegetables, lean proteins. Now, where the difference lies is going to be in the reducing the sodium, DASH versus Mediterranean. They're going to place more of an emphasis through the DASH diet, less sodium because of the hypertension, and then the Mediterranean diet's going to be less red meats because of the high cholesterol. One thing I was thinking of in terms of the diets and what to eat is something I learned recently is no food is necessarily the enemy, and the foods are not the bad guys. It's me that I can't stop having 12 cookies a day, you know? So it's me with the problem. So I like to tell everyone, especially through a lot of learning through different rotations that we've done as students and things. I remember I worked in a clinic that specifically serviced the geriatric population, and we had a provider who would always say, you know, it's about enjoying food and enjoying moments with your family. So it's not, you don't have to think about, you know, this has so much salt or things like that. I think it's just about being cognizant and being honest with yourself about what you're eating. And if, you know, myself, for example, I'm like, well, yesterday I had a big cookie day where I just had a lot of things that make my heart happy and make my stomach happy, but now I have to have things that are going to make my lab work happy and my doctor happy. So I think it's just about limiting those days and kind of balancing between those two and toggling around, because I think the main message we want y'all to take away from this is not necessarily living a life of limitation, but just more so living a life of awareness and knowing when to cut back and when you can indulge. So that's what I'll say about the diets.
And all food is good with moderation.
Yes, exactly.
Don't eat 2 bowls of spaghetti.
And you know what? Also, don't eat too many carrots. It makes you orange. Your question? The question was, I mentioned earlier something that kept track of the blood pressure. Was it the machine you're referencing? Okay, we'll pull it up for the picture. And it's got how to write it, how it's written down as well. I don't want to misspell it. So that one's going to be the Omron blood pressure machine. It's MORON. That's just the brand of it. Yeah, and it's an arm one. Yes, ma'am. Yeah, it does keep track. I believe there's a way that you can toggle through the buttons, and it shows you if there is, right? I'm pretty sure my dad's got this one, so you kind of, it depends. That's
Right.
what, yeah.
You have to choose the model that has the memory on it, because there are some that don't have the memory button on them, so it's not going to keep track of them for you. But those are the ones I use in my office as well. So.
I believe it's the Omron Series 3, the one that does keep track of your blood pressure. And it just does it right there on the machine. Yes, ma'am. Okay. Okay. So we were told that she received one, that it was free through Medicare. She received one, I mean the Omron blood pressure machine, just so we can get it on the recording. So if you guys are interested in that, and you have, was it Medicare? Okay, and you've got Medicare, then they'll probably get it for you. I've been hearing also a lot about how people are being able to get exercise watches through their health insurance recently, and they're pretty pricey exercise watches, like $100, $200, and they keep track of your steps and how much you're exercising and things like that. So if you're wanting one of those too, I mean, I don't know, you probably have to get with your doctor to make sure it's covered, but I know of 3 people in my life personally, and they're all ranging in age range too. I know a young person as well as older people that I've gotten them free too for exercise. Any other questions? No, thank you guys. We really appreciate your time. Thank you so much for hearing us out. I know a lot of our messages might be things you guys already know, but it's great exposure for us, and we really appreciate your attention and all the questions y'all had for us. Thank you so much.